Welcome to the online learning series, Traumatic Stress Screening for Child Welfare Professionals, a guide to the University of Minnesota's Traumatic Stress Screen for Children and Adolescents, the TSSCA. This module is part 2 in a 3-part series that has been developed as a collaboration between the Center for Advanced Studies in Child Welfare, the AMBIT Network, and the Institute for Translational Research in Children's Mental Health at the University of Minnesota. These organizations have partnered to plan for and develop training materials for child welfare professionals related to children's mental health. The development of this online learning series and the accompanying research brief further the mission of these organizations by connecting you, child welfare practitioners, to relevant research emerging from the University of Minnesota. Module 1 provided an overview of the context and development of the TSSCA, including the rationale behind its creation, the process of development, the evidence base supporting its use, its limitations, and its specific applications to child welfare. We also discussed the difference between screening and assessment. Module 2 will break down administration of the TSSCA step by step. Module 3 will provide next steps for after you've completed the screen with a client. Module 2 will break down administration of the TSSCA step by step, from organizational considerations to post-screen. This section also provides video demonstrations of screen administration and scoring procedures. This learning module has 2 objectives. First, we aim to provide child welfare professionals with the knowledge needed to administer the TSSCA, and we want to share the experiences of other practitioners who have used this tool in their practice. This module contains 5 sections and is about 60 minutes long. While the module has been developed to be watched in order, you can navigate between sections to review. Section 1 will break down administration of the TSSCA step by step. Section 2 is a video demonstration of administration. Section 3 will provide steps for after you've completed the screen with the client. And Section 4 will introduce you to several practitioners who have used the screen in their practice, who will share notes from their experience with the TSSCA. Section 5 leaves you with additional resources, including links to the screener and research briefs developed to accompany this module. You will also find the link to the online quiz in this section. Section 1, using the TSSCA. Before you begin to implement use of the TSSCA or any trauma screening, you must consider how the screen fits into your organization's overall trauma-informed approach. As covered in Module 1, the creation of the TSSCA was developed in consideration of the National Childhood Traumatic Stress Networks, NCTSNs, and the Substance Abuse and Mental Health Administration, SAMHSA's, recommendations for building trauma-informed child-serving systems. SAMHSA suggests considering the following questions to assess your organization's readiness to adopt a trauma screen. Is screening for traumatic stress right for your system? Does the organization have the capacity to provide trauma-specific treatment or refer to appropriate trauma services? How does your organization ensure that all staff receive basic training on trauma, its impact, and strategies for trauma-informed approaches across the agency and across personnel functions? Many evidence-based assessments exist. However, relatively fewer screens exist for childhood traumatic stress symptomology. The TSSCA was developed to help fill this gap. However, the administration of the screen may reveal a lack of available resources to treat traumatized children in your area. It is important to note that identifying these children may be a first step in identifying need and provide an important rationale for planning for eventual provision of services and trauma-informed practices within your organization. Further, Module 3 will introduce you to some options around Minnesota for connecting children to high-quality care. Even if all these considerations aren't fully met, you may still consider beginning to implement universal screening as a first step. Once you've decided to begin using the TSSCA in your practice, there are several key considerations that must be accounted for before the first administration. First, ensure that all those administrating the assessment have appropriate knowledge and training. While there is no formal training required, TSSCA users should have a basic understanding of trauma, its symptoms, and resulting behaviors. Clinicians should also be familiar with the difference between trauma screening and trauma assessment. Reviewing this learning module is highly recommended. Second, identify a time frame for administering the screening assessment instrument to your client. Screening should occur as early as possible in the assessment and treatment process. For many child welfare organizations, this may mean administering upon intake. Next, identify who will administer the screen to the child, for example, the intake worker, the case manager. And finally, prior to giving the screen for the first time, Pilot the test with a colleague. Once these considerations have been made, you are in a position to begin administering the TSSCA. The TSSCA is available as a PDF for free on the Ambit Network's website. A link to the website is provided at the end of this presentation. A PDF copy has also been made available with this presentation. When you view the form, you'll notice that it's double-sided. The front page is the screening tool. The back provides administration and scoring guidelines. We will begin our administration walkthrough by looking at the layout of the instrument. The top of the screen provides space for basic organizational information. Next, the screen asks directly whether the child has experienced a traumatic event. Below is a list of problems that people sometimes have after experiencing a bad or upsetting event. Bad or upsetting events might include being threatened or hurt, seeing someone else threatened or hurt, or feeling that your life was in danger. Have you ever experienced a bad or upsetting event? Here you can check yes or no. The screen then goes on to ask about the traumatic event. If yes, what was the bad or upsetting event? Please feel free to list more than one. The next portion of the screen contains the 5 screening questions with a 3-choice scale for each answer. There's also an accompanying visual aid to help explain scaling concepts. Never is illustrated by an empty cup. Sometimes it's illustrated by a partially filled cup, and often it's illustrated by a full cup. Also notice that there is a point score next to each answer choice. Never corresponds to a score of 0, sometimes with a 1, and often with a 2. The screen reads, when thinking about your bad or upsetting events, how often have the following problems happened to you during the past month? During the past month, have you 1. Had upsetting thoughts, images, or memories of the event come into your mind when you didn't want them to? 2. Felt afraid, scared, or sad when something reminded you about the event? 3. Tried to stay away from people, places, or activities that reminded you of the event? 4. Had trouble feeling happiness, enjoyment, or love? And 5. Been on the lookout for danger or other things that you are afraid of, for example, looking over your shoulder when there is nothing there. The final section of the tool is for scoring the screen. The back of the form contains administration guidelines, which we discussed earlier in this module, scoring information, background notes, which we explored in detail in Module 1, and references. We will now review the administration and scoring guidelines for the TSSCA. As noted previously, these guidelines are also provided on the back of the screening tool. Development of the screening guidelines was informed by the Chadwick Trauma-Informed Systems Project, Child Welfare Guidelines on Screening and Trauma Symptomology in Children. A link to the full text of the Chadwick Guidelines is provided in the resource section at the end of this presentation. First, determine if you want to give the screen to a child in the presence of a caregiver. Children may respond differently in front of an adult, even an adult they trust. Other children may need encouragement to answer. Again, ideally this would be determined prior to administration. However, certain situations, such as intake, will require that you make the decision at the time of administration. Ensure that you have a plan for administration with a caregiver present and without. Start by building rapport by asking a few non-threatening warm-up questions such as, where do you go to school? Who brought you here today? What's on your cool t-shirt? Hopefully, you will have had time to begin building this rapport before the time of screening. However, in some situations, such as intake, this may not be possible. Building rapport is particularly important for youth who may have experienced complex or ongoing trauma. Youth, in juvenile justice settings for example, may not disclose or acknowledge particular symptoms resulting in a negative screen. If trauma history is known and yet a negative screen occurs, you may still opt to refer that child for assessment. Next, explain the reasons for the screening to the child, or both the child and the caregiver, using simple language, such as, sometimes I ask some questions to help me understand you and what you may need. With caregivers, you could say, this is a screening instrument to assess for the impact of traumatic events. The score helps determine whether your child may benefit from a more thorough trauma assessment. Then, emphasize the brevity of the screening instrument with the child. If a child identifies a bad or upsetting event, state that you will not ask for a lot of details, but just enough to understand what they are thinking about. State that for each of the questions you're looking for a number, and that they do not have to explain why they answered in a particular way. For younger children, establish that they understand the scaling idea. You can use sample questions such as, how often do you brush your teeth? How often do you have ice cream for breakfast? Use the visual aid if needed to help explain the concept more concretely. Explain who will know the results and why. This will vary depending on your organization. Be honest and thorough. This is what the administration guidelines look like on the actual form. Some additional notes to keep in mind that aren't included on the form include the following. Decide whether the child should complete the screen on their own or if reading aloud would be more appropriate. This decision should be based on the child's age, comfort level, and reading ability. If you choose to read the screen aloud, read all portions verbatim. However, after reading verbatim, you may provide guidance interpreting the question to ensure understanding without changing the meaning. Note this on the form. Finally, keep the administration time brief. Total administration time is intended to be 5 to 10 minutes. Section 2 provides you with a video demonstration of administration.
Okay. So Christina, like I said before, my name is Katelyn, and what we're going to do is spend a little time talking today. But first I want to get to know you, and I'm wondering where you like to go to high school, or where you go to high school.
I go to South.
You go to South High School, okay. And what is your favorite class at South?
I like art class.
You like art class?
Mm-hmm.
What are you doing in art right now?
We're working on paintings.
Okay.
Working on paintings using watercolor.
Some watercolor? What are you painting right now?
I'm working on a painting of like the house that I grew up in.
Oh wow. Well, that sounds beautiful. Yeah. So, yeah, you're welcome. What I want to do today, Christina, is I'm going to ask you a couple of questions about some difficult or stressful things that may have happened in your life. Okay. And we're going to go through them pretty quickly, so it's going to be a relatively short number of questions, all right? And I'm not going to be asking you to go into any detail about what happened. So I'm not going to be asking you why you answered in a certain way, all right? And if you have any questions, please let me know, okay? So what I want to start off with is that sometimes people have experienced a bad or upsetting event, okay? And these events might include being threatened or hurt in some way, seeing someone else threatened or hurt. So this could be a friend, it could be a family member, or feeling like your life was in danger in some way. I'm wondering if you've experienced any sort of bad or upsetting event.
Yeah, I have.
You have. Would you tell me a little bit about that? What happened?
Well, the big one, the worst thing that's ever happened to me, was I got 2 summers ago, I got bit by a dog.
Okay. And that was 2 summers ago?
2 summers ago.
Okay.
I had to go to the hospital for like 3 days.
Oh my goodness. For 3 days. That sounds really scary.
It was really scary.
Yeah, absolutely. Well, what I want you to do is I'm going to have you think about when you were bit by the dog, okay, a couple summers ago.
Okay.
All right. And when you're thinking about being bit by this dog, how often have you had the following problems, or how often have the following problems happened to you? I want you to think about the past month. So a month is about 4 weeks. Let's think about what happened to you about a month ago. Was there any sort of, so right now we're in the summertime, so it was about June. It was the end of June. Mm-hmm. Were you doing anything exciting or different at the end of June?
This year?
Yeah.
No, I wasn't doing anything.
Okay. Well, I want you to just, in your mind, think about how you've been feeling for the last 4 weeks, okay? So about the last month. So during the past month, Christina, how often have you had upsetting thoughts, images, or memories of the event come into your mind when you didn't want them to? And I want you to think about this scale, all right? So that you can think about it like an empty cup to a full cup. So either never, sometimes, or often. right, so how often during the past month have you had upsetting thoughts, images, or memories of the dog biting you come into your mind when you didn't want them to?
Sometimes.
Sometimes, okay. During the past month, how often have you felt afraid, scared, or sad when something reminded you about the dog biting you?
Usually just if I see dogs out.
Sure, sure. Does that happen sometimes? Does that happen often, or does it happen never?
Yes, sometimes.
Sure. How often over the past month have you tried to stay away from people, places, or activities that reminded you of the event?
I guess often. Okay. I try not to go to things at all if I know there's going to be a lot of animals.
A lot of animals. Mm-hmm. How often have you had trouble feeling happiness, enjoyment, or love?
Never.
Never? Okay. And this is the last question. Christina, how often have you been on the lookout for danger or other things that you are afraid of? So for example, do you ever find yourself looking over your shoulder when nothing is there?
Sometimes.
Sometimes? Would you say sometimes?
Yes, sometimes.
Okay. All right. So those were the questions that I wanted to ask you. What was that like?
It was okay.
It was okay?
Yeah.
Yeah. Well, I wanted to ask you these questions because it's one way for me to gather information about how you're feeling right now,
Mm-hmm.
and then about how best I can help you and how best we can help you going forward. Do you have any questions for me?
So who are you going to tell about my answers, or what do my answers mean?
That's a great question. And so what I'm going to do is I'm going to score this up, and it looks like from your score, it looks like you sometimes think about this bad thing happening to you. Mm-hmm. Okay? Right? And after a bad thing happens, it's very normal to have feelings like this. Okay? And what I'm going to do is, I think what we might do is refer you to someone who can do a more thorough assessment. So you can talk to them a bit more about some of the feelings you're having and some of the memories you have about the dog bite, because it sounds like you spent a lot of time at the hospital, and it sounds like you oftentimes avoid things right now that may remind you of the dog bite. And so what we're going to do is I'm going to work with your parent and refer you to someone who can ask you a few more questions about this. Okay, and we can see how to best help you going forward. Does that sound okay?
Yeah, sounds good.
Okay. All right, well, it was so nice to meet you, Christina, and please let me know if you have any questions.
Thank you.
Yeah, you're welcome.
Section 3, Post-Screen. After the screen is complete, follow up with the child to assess the effects of the screening instrument by asking questions such as, what was that like for you? Document the results in the child's case plan and establish follow-up plans, which may include a referral for an in-depth trauma assessment. Resources for referral and assessment will be discussed in Module 3. As a note, it is important to clarify that while disclosing trauma and trauma symptoms may be a very difficult conversation, screening is the first step in providing the child with appropriate care. If you approach the screen without anxiety, the child will be less anxious. Remember, what has happened to the child already happened, and screening is the first step for providing that child with therapeutic services. Here's an example of what the post-screen and these reminders look like on the form. Again, remember that the information in this module is meant to serve as an introduction. All the information here is also included on the back of the TSSCA form. Scoring the completed screen is very straightforward. Each question has 3 choices, and each choice corresponds with a numeric score, never equals 0, sometimes equals 1, and often equals 2. Sum the scores from questions 1 through 5 to yield the total score. A score of 4 indicates borderline traumatic stress symptomology. This could result in a referral for trauma assessment. A score of 5 or higher indicates moderate to severe traumatic stress symptomology. This is a likely referral for trauma assessment. As noted in Module 1, a cutoff score of 4 yields 89% sensitivity and 79% specificity. A cutoff score of 5 or higher yields 84% sensitivity and 70% specificity. This means that a minority of children with trauma symptomology may not be identified by this screen. If it is suspected or known that a child is not disclosing, other case information can and should be considered to make a referral for further assessment. This is how the scoring explanation looks on the TSSCA form. Here is a brief video demonstrating the scoring procedure.
So in the never column, I see that the total is 0. Sometimes we have 1, 2, and 3 responses, each worth 1 point. So I put a 3 here. And we have 1 often response, which is 2. So I put it down here. So 3 plus 2 gives us a total of 5.
Section 4, Practitioner Perspectives. In this section of the presentation, we want to share the perspectives of child welfare practitioners in Minnesota who have used the TSSCA in their practice. Practitioners share their perspective through written and phone interviews, and select responses are included here. Some answers have been paraphrased for clarity and brevity. 4 different practitioners chose to volunteer this information. A mental health therapist and clinical coordinator for youth within the juvenile justice and child welfare system with 35 years of experience. A director of a residential treatment program with more than 19 years of experience. A 20-year-old veteran child protection assessment worker, case manager, and now lead child service supervisor. A mental health professional with more than 25 years of experience in the field working with individuals of all ages. At this time, they work as a clinical supervisor with a small caseload providing treatment for childhood trauma using TFCBT. How were you introduced to the TSSCA?
I was introduced to the TSSCA through my learning collaborations with trauma and grief component therapy for adolescents and trauma-focused cognitive behavioral therapy.
I was introduced through an AMBIT group.
Through the AMBIT leadership team.
I was introduced through Chris Bray and Sabrina Matheny of AMBIT. We were part of a grant seeking to make our community trauma-informed around children. One of the things we felt strongly as a group was that we wanted to support universal screening, so we were part of the first pilot. As things were formalized and the validity studies came through to support the use of the instrument empirically, we began data collecting as a site. What sort of administration and background training on the tool did you receive?
I administer many different screening tools with the TSSCA. The tool was shared with me and I was briefly explained the how-to, as well as read through the administration and scoring guidelines noted on the back of the screen and took it from there.
I learned in a collaborative group.
My staff and I were introduced to the tool, and staff began utilizing it with clients. There was no real training other than discussing engagement of clients, being mindful of the timing, and introducing the tool once there was some rapport and trust if possible.
It was very well described in the back. We sat down as a group and read through the prompts that allowed us to be able to train. What I found most helpful was the test questions helped kids understand about the Likert scaling. They loved the questions about toothbrushing or ice cream for breakfast, except for the 3-year-olds. I found that most kids understand the cups range. In fact, we often call this test the cups because of the visual. I probably had a 15 to 20 minute discussion with other folks in human services, and then I just began rolling it out, beginning with foster care the next day. I spent about 5 minutes teaching my coworker, and she went out to a home and was able to give it to her first client. Why did you choose to begin using the TSSCA in your practice?
I like that the tool is very brief and specifically addresses symptomology.
After AMBIT provided a series of training to our staff and community through our joint effort of creating a trauma-informed community, staff were eager to get a screening tool. They felt they needed a tool to help identify when trauma assessments were needed for kids versus other types of assessments.
Ease of use. It's a very short screener. The fact that it does not require education or professional licensure. The applicability to all of our staff. Interest and then familiarity and respect for the team's work at AMBIT.
How is the TSSCA relevant to the communities you work with in child welfare practice?
All of our populations experience traumatic stress, and oftentimes these specific questions are never asked.
The screen allows us to know better what the driving factor is in behavior, which informs treatment.
With the help of AMBIT, we have more practitioners in our community who are trained in completing trauma assessments and TFCBT. The needs of the children we serve vary, and there are many. The TSA helps to target the needs and the best approach in addressing them. It hopefully helps us get it right earlier.
A lot of my time is spent supervising and coordinating the care of kids in foster care, and such a significant number of them has had life trauma. I like the TSSCA because I think the age limit down to 3 is helpful. Also, the fact that it is very low tech, visual, and can be easily administered in a short period of time. It's point of entrance. We do it when we begin services, so it was very easy to add. How did your organization prepare to begin to administer the TSSCA more widely?
As we have been looking bigger picture as to how and screen all youth entering the juvenile justice system for mental health and trauma, we decided screening tools we wish to administer at intake, and we thought the TSSCA was a good tool to get specifically at our trauma question. We are using the TSSCA along with MAYSI2, and I think that they complement each other nicely regarding trauma.
We give it to all youth upon admission.
We decided to pilot it with children in OHP up to age 12. We did not want to require for all cases initially due to already high work demands and wanted them to start getting comfortable using the tool.
I talked to someone who is an amazing data manager, and she partnered with me on a quarterly data collection basis. I created 2 folders, so all frontline staff who gave the test provided me a paper copy, and then quarterly, the Data Ninja compiled everything into an Excel spreadsheet by program. I also created a flyer explaining and went to each meeting to let people know that we were going to be doing this. I'm kind of a cheerleader in our organization. I also check in regularly to make sure that everything's happening. What steps do you take after administering the TSSCA?
For each screen that flags for mental health trauma concerns, a formal letter are written to the youth, parent, guardian, along with referring agent noting the areas that they flagged for concern. Trauma is a big one. I include my contact information to assist further with questions or guidance, as well as provide a list of community resources they may wish to be in contact with as well. We also ask that the referring agent communicate with the youth and parent at their initial meeting regarding next steps they have taken.
Staff make referrals when determined to be needed. Internal tracking of results are being tracked and being shared with AMBIT.
I review them, and any screens that are above 4, I make plans for follow-through. Sometimes we'll do further assessment even if the score is under 4 but the child has known trauma. I make plans to get a comprehensive trauma assessment through the TFCBT protocol. If they are working with an outside therapist, we give the information to them following appropriate protocol and leave it to their clinical discretion. We will also help them arrange that comprehensive assessment.
How has the TSSCA changed your practice?
It has helped my employees have a deeper knowledge of the kids we serve from a tool and not just me telling them.
Helps us better identify kids' needs around trauma issues rather than guessing. Helps us make more specific referrals based on their needs.
It's really supported an overall trauma-informed approach and then a specific clinical expertise in how we approach care. It's changed our practice. It levels the playing field. Youth are asked the questions in an informed way that's pretty matter-of-fact.
What difficulties or challenges have you faced using the TSSCA?
Because there is a self-report, youth may not be at a place where they can or are willing to share their traumas.
Staff remembering to do it and take the time. They have a number of sensitive requirements in CP.
I think some of our people are uncomfortable. They want to spend a session to establish rapport before they ask. Also, sometimes people balk at asking permission before we screen. However, our clients all sign a consent to treat. I think that if we're going to create change, it's got to start with us, and we need to ask the hard questions. Kids are pretty used to these questions. You don't need to dance around the issue. And then they don't always tell us, but when they do, then we need to do something about it.
What advice would you give to a child welfare practitioner about to begin using the TSSCA in their practice?
My advice would be to make sure you use the tool, and if the youth writes something vague down, follow up. Oftentimes, they may need just a little more help getting it out with what they are trying to say. Also, don't be surprised at how many will actually write down their hurts. Many want help.
Take the time to do it. It's worth it. It's quick and it's easy. Kids deserve to have the right referrals made based on their individual's needs. What advice would you give to a supervisor or administrator who is considering use of the TSSA in their agency?
This brief self-report screening tool allows a youth to voice their hurts. What you will likely see is that you have a lot more hurting kids than you thought. You can then play a key role in getting these youth connected with the right services to help them heal. Can't get any better than that.
Well, I think Nike has already said it. Just do it. I think it's the best. I think it's our community and civic responsibility to be helpers and to ask the right questions. I'm a trauma survivor myself, and I feel like I knew I was right for this vocation when I knew that I wanted to grow up and ask the right questions, and I think the TSSCA allows us to ask the right questions. I would encourage people not to shy away. If we don't change the way we talk about trauma, how do we expect people to be healing in the open? Section 5, Closing. Thank you for participating in the Traumatic Stress Screening for Child Welfare Professionals Module 2 using the TSSCA. The final section of this presentation provides you with resources for further learning, acknowledgments, and references. For additional information on the subjects covered in this series, please refer to the following resources. If you have any questions, please reach out to Chris Bray or Sophia Frank. Special thanks to the following individuals for their contributions to this learning series. The following resources were used to develop this learning series. Congratulations, you have completed the Traumatic Stress Screening for Child Welfare Professionals Module 2 using the TSSCA.